This is Dr. Vaishali and I'm reading from the book Spirit of Homeopathy, book written by Dr. Rajan Sankaran, and chapter number 43, Remedy Relationship. In this chapter, we shall examine the basis of complementary inimical relationship between remedies. Complementary remedies. Complementary remedies are those that are frequently found to be indicated after each other, and we shall attempt to find out why this is so. For example, staphysagria state is one in which a person feels humiliated and insulted. Naturally, this state will arise more easily in one who originally had pride and egotism than in one who did not have. We know that staphysagria is often followed by the sulfur. In other words, sulfur state of egotism predisposed to the staphysagria state of humiliation. Therefore, when we see staphysagria in a person, it would be worthwhile examining whether there is a sulfur state behind it or not, which therefore may follow it. Of course, a particular state can exist independently, but there is a good chance that it exists because of the predisposition caused by another state in the background, and this background state is usually the opposite. To take another example, Stamonium has a state of tremendous terror and violence coming from the feeling of being lost and forsaken in dangerous place. The predisposition required to develop this state may well be one of the great security, like living in a shell. Such a need for security is found in the calcarea carb state, and it is this kind of person who, with one is slightly exciting cause of fear, will easily develop a stamonium state. So we have to understand that stamonium state may come about easily in the calcarea carb person. Therefore, you can suspect a background of calcarea carb when you see a stamonium state. We have also talked in the chapter Unsuitable Posture about the transmission of the root from the generation to another. It is possible that when a stramonium root is transmitted, means probably the father or mother had a strong stramonium state, the root of the calcarea carb is also transmitted, being the background of the state. Thus, you find this remedy forming a pair, just like a staphysagria and sulfur. Another relationship I have seen in the practice is the one based with hyoscyamus and the staphysagria. Staphysagria is a state of suppressed hostility and suppressed sexuality. When he breaks down, the staphysagria patient may develop a state like a manic depressive psychosis, and in the manic state, there will be over sexuality and expressed hostility. This is the hyoscyamus state. Some year ago, I saw a patient who presented with a mania requiring the hyoscyamus, which gave immediate relief. There was a staphysagria state in the background, which became apparent after the hyoscyamus state had subsided. And after staphysagria was given, the patient did not suffer a relapse. Means this case is given in the acute processes. So we see one state predisposed to another. The two states form a pair and are usually in some way opposite to each other. Another well-known pair is Natrium and Ignatia. We find that when Ignatia comes up an acute remedy, it is usually followed by the Natrium. Again, there seems to be an opposite state, with Ignatia having constant and active grief, while in the Natrium it is a passive, chronic and underlying. Similarly, if you take anxiety, which is subconscious, reserved and unexpressed, you have thuja, and its complementary is arsenic alb. With over anxiety, tremendous restlessness and expression of the fear. Another good example is the relationship between the aconite and the sulfur. The contrast is quite striking, where sulfur is indifferent, philosophical, careless, cheerful and imaginative. He is not really bothered about anything, but when this person had a sudden fright or fever, his state changed to one of tremendous anxiety and excitement with heat and restlessness. So, when the indifference of sulfur is suddenly jolted, he will develop a aconite state. If a person is already very anxious, like one who is in arsenic state, then suddenly stress would not make him go into the aconite state. Let us take an example of the physical level. A person is indolent, fat, fair, and flabby and not used to exercise. If the calcia patient lifts a heavy object suddenly, he will get a sprain. So his indolence predisposes him to a rust toxicum state. These two remedies are complementary, the one with a tremendous restlessness and the other with a great indolence. If we examine complementary relationship in this way, we find a lot of pair with the opposite state to each other. Nux vomica and sulfur, for example. Nux vomica is so clean and sulfur is so dirty. Nux vomica is so chilly and sulfur is so hot. Nux vomica is ardent and vehement while sulfur is careless and lazy. So, sulfur predisposed to the nux vomica and nux vomica to sulfur. Lachesis and lycopodium is another set of complementary remedy where again the contrast is obvious. Lachesis is always competing with others. He wants to do better than others. And lycopodium is always competing with himself and doubting his own capacity. A person who keeps doubting his own capacity is predisposed to develop a lack of self-confidence. Lachesis predisposed to lycopodium and lycopodium predisposed to lachesis. They are such an opposite trait. The lachesis is left-sided and lycopodium is right-sided. Lachesis does not like hot drinks and lycopodium craves them. Lachesis is worse in the morning after sleep and lycopodium is worse in the evening and before sleep. We can look another famous relationship, the one between Pulsatilla and Silesia. Silesia is so obstinate, Pulsatilla is so mild. Silesia is rigid in his view while Pulsatilla is irresolute. Silesia is aversion to consolation and Pulsatilla crave for it. Silesia is so egoistical and Pulsatilla is so humble. Silesia is hard, Pulsatilla is soft. Silesia is chilly, Pulsatilla is hot. Silesia cannot tolerate a draft of air, Pulsatilla cannot live without it. These two opposite states complement each other. Hardness predisposed to softness and softness predisposed to hardness. Just like a philosophical attitude predisposed to anxiety and anxiety predisposed to philosophical attitude. We can give many more examples for this. That when we see remedy a patient, we have examined whether it exists independently or whether it exists because of the predisposition caused by some other remedy state. When doing so, it is necessary to consider those remedies which are some way opposite in nature to the present one. We may find after giving the first remedy, we have symptom of the complementary remedy appearing.